You're going to be expected to know a lot of this material very quickly. Well, howdy YouTube family. It is Bolt CRNA coming to you again with another week's topic. So this week we're going to be talking about study habits and study tips and tricks. I got that word out for you. About how I studied in CRNA school and maybe some things that you could use to help you study, not just in CRNA school, but in life in general, grad school, nursing school, whatever you're doing right now in life. These are tips that can really help anybody out. So let's get into it. So I asked you guys on Instagram what specifically you wanted to know, what study questions that you really had. And the first one I really like, I'm gonna hit it off with a bang here. The first one is, what is the lowest grade I can get to pass? You're going straight for the money shot on that one. You just wanna know, how can I get by lowest denominator? I'm hoping you're kidding here, but if you're not, I will tell you, the lowest grade for most CRNA programs that's considered passing is an 80. So anything less than an 80 is an F in CRNA school, and you cannot make Fs and remain in the program. So you will be immediately removed from the program, no questions asked. No redos, no remediation, no come back next year and retry again. You're out, go choose a different career if you score in a course less than 80%. What were the key general concepts you felt the professors tested on most? So of course, safety. They're gonna be wanting to understand that, or know that you understand the safety ideas of what you're doing. They're also gonna wanna know that you understand the science behind what you're doing. You're giving this drug versus this drug, why? What's the pharmacology profile of these drugs that would indicate why you would be doing one versus the other? If the patient is presenting with this type of clinical sign neurologically, do you understand the anatomy of the circle of Willis, and do you understand the pathophysiology of if you had a vertebral artery blockage, where the blood flow from that area would be going, and maybe what you might see clinically from this? Like, those are things that they're going to be assessing and really targeting you on. They're looking that you understand the concepts, but not just understanding the concepts. They really want to know that you have mastered it to the point that they can throw a couple twists in the equation and you still can critically think your way to the correct answer, which is almost always how the questions are asked. Is they'll give you in lecture A, B, and C. They will expect you to study C and D at home. Or wait, did I say that wrong? I just said that wrong. They will give you A, B, and C in lecture and say, on paper, this is A, B, and C. This is what we think. Then they will expect you to go home and figure out D and E from the resources they give you. So you add those factors together. And then they're going to ask you about J on the exam. And they're going to say, have you figured out this information so well that we gave you A, B, and C, we gave you the resources and a link or something to go home and supplement the material with this additional stuff. Then you use your critical thinking abilities to figure out what J is, because J is the answer on the exam. So that's kind of how all the questions are worded in CRNA school, and that's why they're so difficult. Rote memorization will fail you in CRNA school. You cannot do that. You have to actually know the material. What was your biggest resource for study? I went to lecture, every single lecture, all the time. Well, I mean, out of 3 years, I probably missed a handful of lectures because I was sick or something was wrong. But I pretty much always went to lecture because I'm an auditory learner. So I would go to lecture. The professors would always send us the PowerPoint link beforehand of what they were going to be giving a lecture on and the PowerPoint. And sometimes they would include their notes with it and sometimes they wouldn't. It's really nice that they included their personal notes with the PowerPoint, because that would have additional information from textbooks and stuff backing up where they got the information for that slide, because of course slides are not going to be 5 paragraphs long. It'll be, key points. So if they give their notes with it, that was a really awesome feature because you could reference out and supplement that information. So I would print those out and I would make notes. And later on in the semesters, I stopped printing them and I started just keeping them on my laptop, and I had a notation ability on my PowerPoint slides so that I could make text notes throughout the lecture and talk about whatever they were discussing or things that I needed to supplement the information with. I would supplement it on the PowerPoint slide. Then I would go home and I would re-synthesize the information and streamline it in an outline. And that was probably my biggest resource in things that kind of the starting building blocks of how I studied in CRNA school. The professors usually give you a clear idea of what's on the exam. Not really, no. And that kind of ties back into my answer earlier about how the exams are. They're not going to give you a clear indication of exactly what's on the exam. They're going to, like I said, they're going to give you A, B, and C. They're going to ask you about J on the exam. So they're going to have given you some other resources to go home and study on your free time. They're going to have told you to reference Apex, or they're going to have told you to have looked at this book or whatever, but they're not going to spoon feed you in CRNA school. They will expect you to enrich your knowledge outside of what they've taught you, and they will not only expect you to do that, but then to use that to critical think and even take information that they know you learned last year in a whole different course. The professors know you learned this information in a different course. They may include that information in a question in their class a year later. And if you've already dumped that information from a year ago, you're screwed for that test. Was most of your studying from lecture notes, textbooks, YouTube vids, or apps? So like I was saying earlier, the PowerPoint with their notes and then my notes, and then I would synthesize it in an outline of all the material that we went through, and then I would record myself speaking my outline and all my notes and all the relevant information that I thought, and sometimes I would supplement it and add additional things to it from other resources that I had found, like through the textbooks or apps or something, or maybe a YouTube video that helped explain it to me a little better. I would add that into the portion with it, record all those things, listen to that over and over and over again, and then I also would reference, I didn't use a lot of textbooks because I found that most of the PowerPoints were course places from the textbook that they've taken out. And so that would have a lot of that core textbook information already in it. It's pretty wordy and meaty what their PowerPoints were, and that was a lot of the slides and sections of the textbook. So I'm not the type of person that reads well, I read fine, but I mean, I don't learn that way. It's not a high yield way of learning for me to read through a textbook. I usually don't absorb that information, so I just don't use that method. I would use apps, so like Apex or Valley Anesthesia. These were apps and books and stuff that had Quizlets, or not Quizlets, a whole different app, but would have quizzes and different ways that you could reference the material and kind of grind it a little bit more. How far in advance did you study for exams? So I began studying the moment we left class. So if you lectured for 3 hours today on a certain subject, I would go home and I would synthesize that. I would probably spend 5 or 6 hours synthesizing that information, recording it, and starting to listen to it, and already getting myself in the study habit. And I pretty much did that every single day, because you're gonna have so much material coming at you so fast. If you let it pile up and you don't tackle it head on every day that it's coming at you, you'll drown, because it'll be overwhelming. If you said like, oh, well, I'll record it later this weekend or something, you're not gonna have time, because this weekend you're gonna need to actually be like mastering the content after you've studied it 3 or 4 different times already by that point, so that you're gonna be ready for Monday's exam. And so there's just no time for you to wait and put things off until the weekend or next week to study something. You'll definitely fail. So I would say as soon as we left class, I began studying the material we just talked about. And then if I knew the exam was going to be on Monday, you can bet that Friday night, Saturday, and Sunday was going to be like 12-hour days of just slamming material. And you never want to just slam one subject's material the whole time, even if you know the exam's coming up. You need to supplement in the other test, because a lot of times, just because you have the anatomy exam Monday doesn't mean you're not going to have a biochemistry exam Tuesday and a pharmacology exam Thursday. You might have multiple exams coming up. So if you try and just focus on one topic and try and slam and really cram for that thing all at once and neglect your other topics and your other subjects, you're going to fail those exams, and a few days later when you have to take those. So you have to really stay up on everything. I definitely would prioritize the most nearest exam that's coming up. What did your study schedule look like in a single week? This would change throughout the program depending on which classes I was taking and what days I had to be at the hospital. Sometimes I would be on call, like especially as a third year, you would be on call. Your weekends would be on trauma call at the hospital, and you would have to stay at the hospital or nearby the hospital. There were other times where, especially as a third year, your clinical schedule is really demanding. There would be times where I would work 12 or 13-hour day at the pediatric anesthesia rotation, and then I would go home and I would still be on call that night. And if I got called back, I would have to come back and do a midnight case in the OR. So yeah, your study schedule and your habits kind of change around as that's happening, but luckily most programs are more front loaded with the didactics. So towards the third year, they're more heavily clinical rotation based because they know they're going to demand a lot of your time at the end for clinical stuff. Have as much heavy studying, mostly board studying prep in third year. I'd say second year is pretty difficult because you still have some difficult courses and you still have to be pretty frequently in clinical rotations. During first year, when it was all front loaded, I studied pretty much every day but one. I usually took Sunday off. I would usually go to class Monday through Friday. I would go home. I would study until it was time for dinner. I would usually go try and work out at least 3 or 4 times a week. Then I would eat dinner. Then I would try and relax for 30 or 45 minutes and maybe watch a YouTube video or do something that was not school related. And then I would usually hit the study materials again until like 9:30 or 10, until it was time to go to bed. And then I would listen, like I've mentioned, I would listen to the study material on repeat while I slept. And then I'd get up in the morning, 7 a.m. the next morning, go to class again. And I would just do that, 5 days a week. And then on Saturdays, it was usually like a 12-hour day of studying. And then Sundays, I would try and take off to spend time with friends and family. Second year, when we started the clinical rotations, that Sunday day off went away real fast because when you're in the hospital 3 or 4 days a week, you just don't have the time or the bandwidth to study like you used to in first year. So your weekends are just study session. Like the whole weekend is just a cram session of studying to catch up because you were in the hospital Monday through Thursday or Monday through Friday during the week. I got asked, it seems like CRNA school is less team oriented than med school. Is that true? I don't know. I never went to med school. I mean, I've known med students and I've seen, their content on YouTube and stuff like that. I don't know that is it that much team based what they do in med school either? If you're asking me, is CRNA school team based? No, it's not. It's very independent. It's very much you. Will be occasionally a research project where they'll give you the option to work with someone else during a project or something. Usually your doctoral courses will have multiple projects. Each course is going to have multiple projects due throughout the whole semester. They'll give you usually one or so of those that they'll say you can collaborate with someone else and have a research partner on these things. So in those elements, you might work in a team slightly, but in general, it's very much solo. Like you are expected to study for this, understand this content on your own. You go to clinicals. Anesthesia is not really so much of a team sport. So yeah, it's fairly independent. And I don't know, I'd like to hear from med students maybe who are watching. Do you feel like it's kind of a team-based learning situation? Now, the only time that I'll say that we did have team-based was gross anatomy class. We had a gross anatomy course, which was just pretty much human dissection, and 4 of us shared a cadaver. And the 4 of us were lab partners for the whole semester, and we dissected together, and if I cut too much and I messed the muscle tissue up or did something wrong, it affected the rest of the team because that was our cadaver and I messed it up. So in that sense, yeah, it was kind of a team, but that was really the only class that was like that. What math did you need for CRNA school? Like not trigonometry or anything like that. You're really going to be using typical addition, subtraction, and multiplying, fractions, percentages, move the decimal point over, things like that. Not complex. You're going to be using pharmacology type math. You're not really doing crazy equations that I can think of. I mean, there are some really weird physics concepts that look like bizarre math equations, and there will be things that you see like Fick's principle and different concepts like that seem mathematical. It's not really math in the sense that you're maybe thinking like pre-calculus or something. You're not going to be doing any of that. Oh, speaking of, next question says, how much chemistry or physics should you expect in CRNA school? That's going to depend on your program. Some programs incorporate chemistry and physics into a lot of their different anesthesia courses throughout the program, and then other programs will have a whole semester of just one single class that's just really heavy chemistry and physics, and they teach you all those types of biochem and type concepts in that one semester class. It just depends. My program did a little bit of both. We did have one organic chemistry course that we had to take, and then we also had a lot of our concepts of physics and chemistry incorporated into maybe like 5 or 6 different courses that we took, because it really is tied into a lot of concepts, especially in higher level of anesthesia courses that you're really learning, the top level of what the content is. It's going to have a lot of kind of confusing physics concepts and rules and stuff that govern blood flow and things like that through the body. A lot of you guys are asking me chemistry questions. Someone else is saying, do I remember undergrad chemistry? No, I do not. I remember very basic. I remember like balancing the equations and like moving electrons or something like that. And I remember being pretty terrible with the little glass beakers and stuff in the lab class and things like that. But no. Do I remember the content very well? You said, help, I'm starting my program in a few months. What supplies must I have? There's really not that much you have to buy. And I guess it's that you're nervous and you're thinking, what if I'm a great consumerist, I'll be able to be successful in the program. There's not really that much you need to buy to be successful in the program. I mean, obviously a working laptop is going to be important. A working computer is going to be important. I would say a cell phone that has apps is probably important in this day and age where we use lots of apps, especially clinically. You'll be expected to know a lot of things on the fly, and I'm just telling you, if you are trying to carry an app, there's like the Vargo Mega Anesthesia app. It's like having 12 or 14 different textbooks in the palm of your hand. And that's the reality of most of your textbooks is you're going to be expected to know a lot of this material very quickly, and in lieu of you carrying around 14 textbooks around your back, you need to have them on PDFs, the book forms on your computer or something. If you're the type of person who just likes touching an iPad and just likes tapping iPads, I had some classmates that like doing that. And if you like to do that, then get you an iPad. Did I have one? No. Did a lot of other people have one and did fine? No. Or yes. Wait. A lot of people did fine without iPads, is what I'm trying to say. So don't worry about iPads. It doesn't make a difference. Is there any other special crazy things that you need? No. I mean, pencils, pens, Trapper Keeper. Get you a Trapper Keeper with some Lisa Frank stickers on there. That's what you need. Last question is, I'm about to start and notice first semester there seems to be some busy work. How did you prioritize these DNP courses versus your anesthesia courses? Years ago, they started transitioning the programs to all doctoral. And part of having a doctorate degree requires there's a certain level of courses of a certain type that you have to take to be granted a doctorate title when you graduate. For the DNP, there's some specific classes you take. I took these courses, and a lot of people like to call them busy work. It's not really busy work. This is material that everyone else who has a doctoral degree has had to go through in some form or fashion. Essentially, it's research, it's leadership, it's showing you a higher level, more macro view of the concepts that you're studying. We did take these courses with other students who were nurse practitioners or nurse executives who are going for their DNP in leadership. These are not fluff classes. These are not busy work classes. They're not core science courses, so maybe that's why it feels different to you, and it's not directly related to you being able to practice anesthesia. So in that sense, yes, it's different. Should you completely neglect them or regard them as fluff? No, because it will bite you in the butt if you do, because they actually can be quite time consuming, and there's a lot of material there. There's lots of research in there. And I would say in some instances I would get frustrated with these courses because there's it's a lot of APA format. It's a lot of how do I defend this topic, and how do I find 6 sources that I can cite that are all done in proper APA format to give my opinion back on a forum post about why I disagree with this topic or why I agree with this thing, and how do I back it up. And it's pretty much just training you in the ways of research and appropriate research and disseminating research, and some other things too. Epidemiology, we did executive healthcare policy, so you could kind of understand what did the Affordable Care Act actually mean? What do these laws do? How do these things govern over our patients and control the environment you're working in? Because remember, you're going to be a doctoral CRNA. You're not going to be just someone who practices anesthesia. You're going to be a leader in your field, and you're going to be expected to understand why the insurance companies aren't reimbursing for this, or why this law got passed, or why does it matter that you talk to your legislators and your senators about this topic for your patients. These things are going to govern over your practice and your patients' lives the rest of your career. So you are expected to know a lot of this information, and yes, it is not direct science related. I would say be thankful for the break from all the science, because you're going to do like 75-80% of science most of the time, and it's going to be very stressful, hard science. So I found a little bit of a nice break to be able to say, okay, I just cram for 3 hours on really complicated chemistry type topics, then my brain is really done with that. So let me switch over to like healthcare policy, or let me switch over to doing a little bit on my doctoral research project and writing some papers. And then sure enough, a couple hours of doing that and you're gonna be really tired of that kind of work too, because it has a special level of exhaustion that goes on with that type of work. And so then you'll say, all right, so let me switch back over and let's do some anatomy now. Let's go back over our A&P topic and that kind of stuff. So yeah, I would say try and balance them out. Be thankful for the classes you're studying when you're studying it, and use your brain, kind of compartmentalize the material as you're doing it. Well, all right guys, that was all of your study questions. I hope that helped you out. If you have a question, ask me down below. I want to hear what your study techniques are and what you use to help study. If you love an iPad, by God, love that iPad. Tell me you love that iPad down below. Hit that like button on the video, subscribe for me, because every week we come back with new topics. And until next week, that's Bolt Out.